It's been about 15 minutes since I started treating, and we were able to restore a little bit of play in eversion, but certainly able to restore some abduction motion in the subtalar joint. And so the calcaneus, the front of the calcaneus points outward, and I'm pleased with that gain. And the same thing on this side. And a little bit of play in eversion, but not much. Let's look at the pelvis now. And I'm the main cameraman. So I hope you can bear with me. So he's lying on his stomach. I'm pushing in superior glide, and I can see his head bob up and down. The force goes through the pelvis and into the rest of the body. So I'm pleased to note that we did gain some motion, and now I'm doing an inferior glide mobility test, and I can see his feet move up and down. And so the force is going through the sacroiliac joint down into the hip and lower extremity. And so here is sacrum, and I can load and spring it. And I'm really pleased with this because I was concerned that this sacroiliac being locked from trauma could be from his childhood. And I didn't know if it would stay that way. It certainly could be from the car wreck as well, which is a more recent event. The sacrotuberous ligament now is able to indent, as it should. It should have a little bit of give there. And so that's a positive sign. And then here's sacrospinous ligament, and that has a little bit of yield, as it is supposed to. And now I'm testing forward rotation on the right side, and I can load it and I can spring it with a reasonable amount of force, about 15 pounds. Let's have you lie on your back, please. And I can take up the slack very freely and glide his pelvis right to left. And now I'm testing posterior rotation, and that mobility is improved. Now let me point the camera to his feet. We worked on his hip muscles, hip rotators, and we gained a little bit of give. So I can now rotate that inward to about 20 degrees, and there's a softer end feel. Okay, so let's have you walk down the hall and back, and let me know how you're feeling.
I definitely feel like there's been changes. It's feels a little bit like you've had a workout.
Okay.
Feels like a positive thing.
Uh-huh.
And I'm pleased with it.
Okay. Is there any difference in the way the legs feel?
The movement is much freer.
Uh-huh. Good. Very good. Well, we have more work to do. I'd like to still gain further motion in the hips and in the subtalar joint. I'm really pleased with how the pelvis softened up. I just didn't know if that would happen. And we certainly have work to do in the upper body, the base of the neck and the upper cervical spine, but I think we're off to a good start. I should thank you for letting me film.
Thank you.
You bet.